Imagine this child. She's having a good time at breakfast and enjoying everything. But at sunset, she's at the operating room. This is not a movie. This is appendicitis. Sudden, it is dangerous, and often misunderstood. I want us to discuss what is this appendicitis, and then be able to recognize its symptoms and act appropriately. I'm Dr. Joshua Derito. I'm a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at appendicitis in children and adults and when to act, because any delay could mean a life lost. So, what is the appendix? We hear of appendicitis and many people have heard about it. What is this appendix anyway? It's a small tube-like pouch at the large intestine head, located in the lower right abdomen, on the right side, below, just next to the groin. And once thought useless, but now believed to be an organ that is very important in support of gut health and immunity. The appendix is small, it is figure-shaped pouch, and it is connected to your larger intestine. And it is located on the lower part of the right side, just next to the groin. So for years, doctors and many people believed that this was left over from evolution. You know how the story of evolution, how we have come a long way up to what we are, the story of the evolution of the world and people. But today, you know that the appendix is one of the organs that is very important in gut immunity, and especially so in children. So you can live without it though, and it gets inflamed, it gets infected, and it can get swollen. And when this happens, removing the appendix could save your life. So it is an organ that can be removed without putting your life in danger. So what is appendicitis? You hear of appendicitis. Appendix, we have said, is there, that small tube-like figure size located at the right iliac fossa, or just next to on the right side of the lower part of the belly. And when we add citis, then it means inflammation. Inflammation is any organ that is swollen, it is painful, it has increased blood supply at where it is affected, and then it is swollen. So that is what happens when you have appendicitis. The appendix gets inflamed, and that means it gets swollen, it gets painful, it gets more blood flow to it, and then it becomes swollen and painful, and it becomes red. So it is usually caused by a blockage, and this leads to bacterial overgrowth, and this can progress very fast and can lead to bursting of the appendix. And if it bursts, then this is an emergency. So appendicitis, we have said, is inflammation of the appendix. It is usually happening when the opening of the appendix is blocked, and this can happen due to stool, due to infection, or anything else that can cause it to get inflamed. So the bacteria, once they are at the appendix and it becomes swollen, it becomes very aggressive, and it can burst, and this can lead to spreading of the infection in your belly. And if this happens, then this can even move outside your belly to the rest of your body, and this can be life-threatening. People can easily die from this inflammatory process, especially when the infection spreads to a whole belly. This is very dangerous. So, how does this appendicitis or inflammation of the appendix present? The presentation varies with the age, and usually in children, it presents with pain around the belly button, and then when this pain is intense, it moves to the right lower part of the belly, and then you can have nausea, you can have vomiting, and you can also have fever. Remember, we said that anything that is inflamed, you get red, it gets swollen, and it gets hot. Then there is loss of appetite, there is crying, there is inability to walk upright. And in adults, there is dull pain over the abdomen, and it could be spreading all over the abdomen. The pain is sharp and it is localized. You can have fever, you can have chills, and you can also have a feeling of vomiting. Then there is pain on the right lower abdomen, and this could be what is telling you that could it be appendicitis. So the pain is very in children, the pain is different from that in adults, and a child might just say that my tummy hurts, and then the child is unable to move, and then he's unable to walk, and he gets fever. So usually in adults the pain is vague, and then it sharpens and localizes. And in the elderly, the pain might be very non-specific and spreading very fast in all the abdomen, and it can be life-threatening. And sometimes you may not know that it is a serious infection, and especially in the elderly, when you miss it out, this appendix can easily burst, and then it can be life-threatening. So how does it progress? Once the symptoms start, they can escalate within 6 to 24 hours, and the risk of rupture increases dramatically after 48 hours. So appendicitis is not a condition that is left to go for more than 48 hours. Action should be taken immediately. And rupture leads to infection of the whole belly, and it could lead to death or yourself being admitted to the ICU. Because the moment you have generalized belly pain, then this is life-threatening. So this is a medical emergency, and it can worsen in a single day, causing infection of the whole abdomen, and sometimes this could be life-endangering. And that's why we say it is important when you think you have appendicitis or you have belly pain that is not relieving, act fast, otherwise you'll pay a high price, ending up in ICU, or you could pay with your life. So what are some of the possibilities, some of the things that can make you misdiagnose appendicitis? One of them is you may think you have food poisoning because of the belly pain. You could have a urinary tract infection because of the pain in the lower abdomen. You may think it's malaria or typhoid because of the fever, and then you may also think you can confuse it also with menstrual cramps because of the way it presents. And it is often happens that we blame the pain for malaria or worms, and that's why many cases of appendicitis are missed out. So when you go to the hospital, it is important that you explain the way you are feeling and tell your doctor how you have been feeling and when did the problem start. So do not ignore these danger signs. One, pain that worsens over hours, especially when it is in the lower abdomen, feeling of vomiting or nausea after the pain starts, inability to stand or walk, and if you have fever or you have chills, and then if you have loss of appetite. If you have these symptoms, don't wait. It is better to go to the hospital. You better be wrong than wait and then be wrong. So, and be too late. So what do you do if you suspect that you could be having appendicitis? One, do not give painkillers before a diagnosis is made. Then go to the hospital immediately and get properly diagnosed. request urgent review by a doctor, and ask for blood work and imaging. What are some of the blood works that can be done? One is you may need a full blood count, and if you have appendicitis, your cell count might go up. Then your doctor will examine you, and when he examines you, he'll be looking for pain, especially intense pain over the right iliac fossa, the region that I've talked about. And this is what we call the McBurney's sign, where he sees the pain at where the appendix is located is highly intense, and it usually worsens with touch. Then once you have been diagnosed, then this is an emergency, and you may require an emergency exploration of your particular area. Depending on what the doctor deems, he might do a central opening of your abdomen, or he may just localize it to where the appendix is located. And if it is found to be inflamed, then it will be removed, and then your recovery will be assured. So how can you prevent appendicitis, and if is it possible to prevent it? The most important thing is knowing the symptoms and also going to the hospital as fast as possible, acting early. Do not doubt your instincts. If you think you have anything serious, go to the hospital, and then talk with others about appendicitis and what are its dangers and why you need to get assistance the soonest possible. So what you do is your responsibility. So to the parent or sibling or neighbor or a friend who says, let's go and get you checked now, that decision could save your life. So when you have appendicitis, remember that appendicitis kills silently. Knowledge is your weapon, that you need to know what to do. And now that you know the signs, if you have listened to this video up to this point, you have the power to protect your family. I would encourage you also, don't retain the knowledge on yourself. Share it with another friend or a neighbor or a family member, so that all of us know how appendicitis presents and can also know what to do. And then also comment if you have had appendicitis. What was your experience? What did you go through? How was the diagnosis made? What was that experience like? So that we share this information with one another, and we educate one another, and we become champions of health. And they follow the overall health YouTube channel for more insights on life-saving insights on various conditions. Remember, act fast, think appendicitis, and this could mean saving a life. So remember also to follow us on our other social media channels for more insightful medical information. Thank you very much. Remember to subscribe and share. Thank you.